Next speaker is coming all the way from Switzerland, Dr. Elgizouli, and he's going to be talking about the landscape of BCL11B.
How does that work? All right. Thank you very much. So I think I should go on right away. I'll be talking about a gene that I've been investigating for the past few years, BCL11B. You heard yesterday BCL11A that inhibits the transfer from fetal to adult hemoglobin. This is a transcription factor similar to BCL11A, but works in a different set of cells. It works essentially in T cells and in brain cells with a dual function. In T cells, it is a master regulator, and the mutation of this gene results in a multisystem anomalies syndrome that has been described a few years ago. And as you can see, the components of that are immunodeficiency, quadriplegia, and multiple brain anomalies. However, this particular patient has never been found in the same form with any other mutation in this gene, and that's the reason of the interest. A large collaboration picked up a number of patients with a different set of mutations that have a different phenotype that is mostly neurodevelopmental and not immune-related, and that's why there is this duality between neurodevelopmental conditions and immunodeficiency related to BCL11B, and that's what I set out to investigate. Now, I won't go through this. This just explains the dual function of BCL11B. And these are sort of our initial cohort. Most of the data I'll show come from this cohort. There is this one patient up there that we couldn't recapitulate. And then downstairs, you can see the patients we collected. The ones red are the ones with the neurodevelopmental delay, and the black ones are the ones with the combined immunodeficiency. The rest of the patients are patients from the literature. And this is their distribution across the gene. You probably don't have time for that. So I'll show you the most important part of the results, the clinical characteristics. You can just believe me. There are two categories. Either you have a neurodevelopmental disorder or you have an immunodeficiency. And immunophenotyping is where some of the mix-up come up. The basic message of that slide is that most of these T cells are terribly exhausted. You've got a few naive cells, a deficiency in naive cells, an expansion in different memory compartments, and most of that expansion is through cells that are not doing much. They're just a lot, but they're not working very well. And when we looked at the B cell compartment of these patients, we saw a sort of a failure of B cell maturation in the number of switched B cells, and also the response to antigen, and you just have to believe me because I can't explain more of that. When we differentiated these B cells in the lab, sort of plasma-class differentiation, we could also see an obvious deficit of differentiation in the B cell compartment. So our initial conclusion is that the heterozygous variants in BCL11B do not necessarily result in this severe leaky skid syndrome that was seen at the very beginning in this first patient. And patients might exhibit a neurodevelopmental disorder and also a cellular phenotype of immune dysfunction that is not necessarily an apparent immune deficiency. And the cellular level immune phenotype seen in these patients is suggestive of some sort of combined immunodeficiency. If you have patients of your own with BCL11B variants, I'd be very happy to work with you. And if you would be willing to send samples, we would investigate them in our labs. And these are the people involved and the money that went into this. Thank you very much. Thank you very much. Thank you. Okay, that one. Thanks.